The most important distant point is pericard 6, 2½ finger breadths above the inner wrist crease between the bones. The point should be treated with strong pressure from the forefinger for 1 to 2 minutes. In mild cases, the use of pericard 6 alone may be sufficient. Here, heart 7 is treated, at the end of the wrist crease on the side of the small finger. It is a very effective sedative point. As a distant point, stomach 36 is very useful. For constipation, first, triple heater 6 is selected, the width of the patient's hand above the wrist joint, between the bones. It should be massaged firmly, parallel to the bones for 1 to 2 minutes. The treatment of this important distant point for constipation can be repeated after half an hour. As local points, we again select stomach 21, 2½ finger breadths next to the midline. This point is located 5 finger breadths above the umbilicus. It is massaged with a circular motion. Next, stomach 25, 2½ finger breadths next to the umbilicus is massaged with a circular motion. These local points in the abdominal area should be massaged for 1 to 2 minutes. Stomach 29 is also massaged with a circular motion. This point is 5 finger breadths below the umbilicus. Stomach 29, 5 finger breadths below the umbilicus. Distant point for constipation is stomach 36, 1 finger breadth next to the shin bone. It is treated with firm massage parallel to the shin bone, as shown here. Massage with the forefinger for 1 to 2 minutes. Stomach 36 is the most important point for all kinds of abdominal disorders. For the treatment of menstrual complaints, a point located 5 finger breadths straight below the umbilicus or 2 finger breadths above the edge of the pubic bone is useful. It should be massaged circling for 1 to 2 minutes. Five finger breadths straight below the umbilicus. Distant points are liver 8, at the inner end of the knee crease. Massaged with a circulating motion. Firm massage. For 1 to 2 minutes. Next, spleen 6, the width of the patient's hand above the inner tip of the ankle, behind the edge of the bone. These distant points should all be massaged firmly in a circular motion for 1 to 2 minutes. In case of severe menstrual pain, the point large intestine 4 between thumb and forefinger is also indicated. For menstrual complaints, Moxibustion may also be useful. Against anxiety, nervousness, and insomnia, the following combinations of points has been found effective. Here, gallbladder 34. The point is located just below and in front of the fibula bone, on the side of the leg below the knee, and it is treated with a circular motion for 1 to 2 minutes. The next point is urinary bladder 62. This point is located beneath the outer tip of the ankle. The point is a very sedative point. In states of anxiety, these points should receive a prolonged treatment. Firm massage with the forefinger for 2 to 3 minutes. The treatment may be repeated after